Hi, I'm Edgar Mocanu. I'm a consultant obstetrician gynecologist and a reproductive medicine sub-specialist at the Rotunda Hospital and the Royal College of Surgeons of Ireland. Infertility is a very common disease. In fact, infertility is a WHO-recognized disease. Approximately 1 in 6 couples have difficulty in conceiving. It is estimated that 150 million couples globally suffer with infertility. It is true that many consider the woman the main culprit if a pregnancy doesn't establish. There's no such thing as male infertility and female infertility. They're just causes on the female side and causes on the male side. And to a certain degree, one can compensate for the other. The male is a significant contributor to the lack of pregnancy establishing. Nowadays, approximately 30% of causes are due to male factors. Those male factors could be as simple as erectile dysfunction, inability to maintain an erection, lack of ejaculation, or poor semen parameters in terms of concentration, the number of sperm per each meal, motility, the sperm moving, there should be at least 40% moving, or morphology, how does the sperm look like? Infertility is a very bad stigma. It starts with couples becoming aware of a diagnosis that many times is eroding personally, eroding your self-esteem, eroding the relationship, and this in itself drags the whole relationship further down, which is not good in terms of conception. It is a well-recognized stressor, and in fact, it has been quantified as a stressor equivalent with the diagnosis of cancer. So from that perspective, it's essential that couples are open, that they discuss the matter of lack to conceive, not from the perspective of being stamped with a diagnosis of infertility, but from the perspective of pursuing investigations to understand better what works and what doesn't work, and identifying means to treat what doesn't work in the hope that a pregnancy will establish spontaneously. It is also advisable that couples do seek a professional help when they need it. There are numerous counselors available around the country that offer both males and females support during these times of difficulty. It is female age dependent. If the woman is younger than 35, it is appropriate to continue trying for 12 months. If the woman is older than 35, after 6 months, they should seek medical advice. There are certain exceptions here, so if in a couple, one of the partners or both partners are aware of certain circumstances that might actually affect their fertility, think previous surgery for the woman, previous surgery to the ovary, previous PID infections, particularly with chlamydia, previous cancer therapy with chemo or radiotherapy. In those circumstances, or previous diagnosis of endometriosis, in those circumstances, it is essential that that couple presents to the doctor earlier, just to be sure they're not wasting 6 months or 12 months of trying when, in fact, a pregnancy might not be possible at all. So both a female or a male that had received chemotherapy or radiotherapy might not have any gametes, I'm talking about eggs and sperm, at all after that treatment.